Mental retardation by Jones HMMBADMS. Definition. Mental retardation, MR, is a generalized disorder appearing before adulthood, characterized by significantly impaired cognitive functioning and deficits in two or more adaptive behaviors. Intelligence quotient score below 70 with sub-average general intellectual functioning and impairment in adaptive behavior appearing before the age of 18 years. 5 causes of mental retardation. 1. Down syndrome patients with trisomy 21, 3 chromosomes 21, instead of the usual 2, represent the overwhelming majority. They have 47 chromosomes, with an extra chromosome 21. For a middle-aged mother, more than 35 years of age, the risk of having a child with Down syndrome with trisomy 21 is about 1 in 100 births. The incidence of Down syndrome is related to maternal age. Both younger maternal age below 15 years and older maternal age above 35 years. In general, children and adults with Down syndrome function within the moderate to severe range of mental retardation. 2. Fragile X syndrome is the most common known genetic cause of mental retardation. Fragile X syndrome is indicated by a weakening or break on one arm of the XX chromosomes, and it is transmitted genetically. Not all children with the Fragile X abnormality have mental retardation. 3. Phenylketonuria, or PKU. PKU is caused by abnormally high levels of the amino acid phenylalanine, usually due to the absence of or an extreme deficiency in phenylalanine hydroxylase, an enzyme that metabolizes phenylalanine. Children with PKU have normal intelligence at birth. 4. Prenatal period maternal chronic illnesses and conditions affecting the normal development of the fetus's CNS include uncontrolled diabetes, anemia, emphysema, hypertension, and long-term use of alcohol and narcotic substances. Maternal infections during pregnancy, especially viral infections, have been known to cause fetal damage and mental retardation. The extent of fetal damage depends on such variables as the type of viral infection, the gestational age of the fetus, and the severity of the illness. 5. Rubella, German measles. Rubella is one of the major cause of congenital malformations and mental retardation caused by maternal infection. The children of affected mothers may show several abnormalities, including congenital heart disease, mental retardation, cataracts, deafness, microcephaly, and microphthalmia. 6. Syphilis in pregnant women was once the main cause of various neuropathological changes in their offspring, including mental retardation. Syphilis is a bacterial disease that is transmitted through sexual contact. Infected mothers can pass the disease to the fetus. If untreated, syphilis produces a number of physical and sensory handicaps in the fetus, including mental retardation. 7. Toxoplasmosis can be transmitted by the mother to the fetus. It causes mild or severe mental retardation and, in severe cases, hydrocephalus, seizures, microcephaly, and chorioretinitis. 8. AIDS. Many fetuses of mothers with AIDS never come to term because of stillbirth or spontaneous abortion. Of infants born infected with the human immunodeficiency virus, HIV, up to half have progressive encephalopathy, mental retardation, and seizures within the first year of life. 9. Fetal alcohol syndrome. Babies born to women who consume alcohol regularly during pregnancy have a high incidence of ADHD, learning disorders, and mental retardation. 10. Prenatal drug exposure. Diazepam, Valium, phenobarbital, luminol, chlorpromazine, opioids, such as heroin. 11. Acquired childhood disorders. Infection. The most serious infections affecting cerebral integrity are encephalitis and meningitis. 12. Measles encephalitis. Most episodes of encephalitis are caused by viruses. Meningitis that was diagnosed late, even when followed by antibiotic treatment, can seriously affect a child's cognitive development. 13. Head trauma. The best-known causes of head injury in children that produces developmental handicaps, including seizures, are motor vehicle accidents, but more head injuries are caused by household accidents, such as falls from tables, from open windows, and on stairways. Child abuse is also a common cause of head injury. 14. Environmental and socio-cultural factors. Mild retardation can result from significant deprivation of nutrition and nurturance. Children who have endured these conditions are subject to long-lasting damage to their physical and emotional development. 15. Prenatal environment compromised by poor medical care and poor maternal nutrition can be contributing factors in the development of mild mental retardation. Types of intellectual disabilities: mental retardation, Down syndrome, Fragile X syndrome, FXS. FXS is the most common known cause of an inherited intellectual disability worldwide. Developmental delay, Prader-Willi syndrome, PWS. Fetal alcohol spectrum disorder, FASD. 4 types of mental retardation. Fragile X syndrome. Fragile X syndrome is the most common known cause of an inherited intellectual disability worldwide. It is a genetic condition caused by a mutation, a change in the DNA structure, in the X chromosome. People born with Fragile X syndrome may experience a wide range of physical, developmental, behavioral, and emotional difficulties. However, the severity can be very varied. Some common signs include a developmental delay, intellectual disability, communication difficulties, anxiety, ADHD, and behaviors similar to autism such as hand flapping, difficulty with social interactions, difficulty processing sensory information, and poor eye contact. Down syndrome. Down syndrome is not a disease or illness, it is a genetic disorder which occurs when someone is born with a full or partial extra copy of chromosome 21 in their DNA. Down syndrome is the most common genetic chromosomal disorder and cause of learning disabilities in children. Developmental delay. When a child develops at a slower rate compared to other children of the same age, they may have a developmental delay. One or more areas of development may be affected, including their ability to move, communicate, learn, understand, or interact with other children. Sometimes children with a developmental delay may not talk, move, or behave in a way that's appropriate for their age, but can progress more quickly as they grow. For others, their developmental delay may become more significant over time and can affect their learning and education. Prader-Willi syndrome, PWS. Prader-Willi syndrome, PWS, is a rare genetic disorder. This disability is quite complex, and it's caused by an abnormality in the genes of chromosome 15. One of the most common symptoms of PWS is a constant and insatiable hunger which typically begins at 2 years of age. People with PWS have an urge to eat because their brain, specifically their hypothalamus, won't tell them that they are full, so they are forever feeling hungry. Fetal alcohol spectrum disorder, FASD. FASD refers to a number of conditions that are caused when an unborn fetus is exposed to alcohol. When a mother is pregnant, alcohol crosses the placenta from the mother's bloodstream into the baby's, exposing the baby to similar concentrations of alcohol. The management of mental retardation in terms of primary prevention, secondary prevention, and tertiary prevention. 3 major categories of intervention are essential in the management of mental retardation: primary, secondary, and tertiary prevention. Primary prevention. First, many cases of both organic and cultural familial mental retardation can be prevented through adequate maternal and child health care, as well as early psychoeducational program. The availability and use of good maternal and child health care is one major step toward the primary prevention of many biological causes of mental retardation. Planning for childbearing can also help prevent mental retardation. A more controversial means of preventing retardation is through diagnostic testing and selective abortion for identified abnormal fetus. Early treatment for syphilis, vaccination against measles, rubella. Genetic, prenatal screening for genetic defects and genetic counseling for families at risk for known inherited disorders can decrease the risk of inherited mental retardation. Secondary prevention. Early social and educational interventions can lead to the secondary prevention of cultural familial retardation. Educational, psychological, and biomedical treatments can help people with mental retardation to raise their achievement levels. The lives of people with mental retardation can be normalized through mainstreaming in public schools and promoting care in the community. The most important current secondary prevention effort is head count for the people living with mental retardation. Tertiary prevention. Careful assessment early in life is critical to tertiary prevention. Medical screening is essential for detecting conditions like PKU. Accurate detection is important because early interventions can help. Treatment of the social and emotional needs of people with mental retardation may include teaching basic self-care skills, such as feeding, toileting, and dressing, during the younger ages and various life survival skills at later ages. Medical care for physical and sensory handicaps also is critical in the treatment of certain types of mental retardation. Medication is not especially helpful in treating the intellectual or socio-emotional problems of people with mental retardation. Normalization means that people with mental retardation are entitled to live as much as possible like other members of society. The major goals of normalization include mainstreaming children with mental retardation into public schools and promoting a role in the community for adults with mental retardation. Within the limits set by the handicapping condition, services must be provided in a setting that restricts personal liberty as little as possible. For many children with mental retardation, the least restrictive environment means mainstreaming them into regular classrooms. Health education. Encourage the mother to join nutrition programs are available to poor children in the first and most critical years of life. Early intervention in situations involving abuse and poverty will also help. Toxic environmental programs to reduce exposure to lead, mercury, and other toxins will reduce toxin-associated retardation. Increased public awareness of the risks of alcohol and drugs during pregnancy can help reduce the incidence of retardation. Infectious. The prevention of congenital rubella syndrome is probably one of the best examples of a successful program to prevent one form of mental retardation. Constant vigilance, such as limiting exposure to cat litter that can cause toxoplasmosis during pregnancy, helps reduce retardation that results from this infection.